So now, after this introduction, it's time to step into the conference in itself and this VPH concept, to have it more concrete, as you said at the beginning. And to start, I propose to let the floor to Frederic Keck to talk about One Health, whose health, anthropological perspectives. Frederic Keck, Research Director of the Social Anthropology Laboratory of CNRS, a senior researcher to be precise. He is also part of Collège de France and EHESS. After working on the history of social anthropology and contemporary biological questions raised by avian influenza, he was the head of the research department of the Musée du Quai Branly between 2014 and 2018. Frederic Keck, it's for you.
Thank you very much. It is a great honor to open this conference on One Health in my hometown of Lyon, even if it is organized online and I have to join you from my lab in Paris. As a social anthropologist, I have worked on zoonosis for the last 15 years. But since this is an opening talk, I will not focus my presentation on what anthropologists can do to improve the surveillance and control of animal diseases, because anthropologists intervene among many other experts to understand the social and cultural aspects of disease transmission. Rather, I want to ask anthropologically what it means to talk about One Health, including humans and animals in shared environment, how it breaks with previous understandings of health, and what is specific of One Health as a concept, among others, which capture the situation of our time, namely a pandemic caused by a zoonotic pathogen. So if the main question raised by the concept of One Health is how to include natural beings in the development of human health, this implies a change in our conception of nature and in our conception of health. So One Health emerged as a concept in 2004 with the initiative of the Wildlife Conservation Society to promote the preservation of biodiversity as a key factor in reducing the risk of emergence of zoonosis. And it was then borrowed by international organizations such as WHO, FAO, and OIE in their collaborations to control the transmission of influenza from wild birds to domestic poultry to humans. So influenza was taken as a model to understand the interdependencies between humans and animals, since a virus infecting a bird in China could cause a new disease that may kill millions of humans. And it became necessary to understand what is a healthy bird to promote the health of humanity at the global level. Hence the collaboration between wildlife specialists, veterinarians, agronomists, and physicians. But this change in the definition of health has also been captured by other concepts. Eco-health was promoted by ecologists to understand how the disruption of ecosystems causes new disease, and thus to include the health of plants in the development of human health. For instance, we have seen with COVID-19 how cutting forests in the south of China may have caused the migration of bats, which transmitted the SARS-CoV-2 virus to humans. Planetary health goes to the global scale to understand the impact of climate change and human habitats on the disruption of ecosystems and the emergence of new diseases. For instance, the displacement of populations of mosquitoes caused by climate change has led to the spread of dengue or Zika, and the melting of the permafrost may lead to the reemergence of old pathogens such as anthrax. And finally, global health is a concept promoted by physicians to insist on the interdependencies between human populations because of the human movements between countries. And global health is a rupture with public health, which was promoted in the 19th century by nation states to control the populations on sovereign territories. While public health relied on epidemiology to assess the risk of diseases in the population, global health relied on other knowledges to assess the transmission of pathogens across the planet. In global health, a disease striking a part of the population is a risk for the rest of the population. So human health has become a homogeneous category because all humans have been conceived as exposed to the same risk, no matter where they live on the planet. And so we have this shift from global health to planetary health. And this shift has been possible because global health has taken two forms. One is humanitarian action, which takes care of any human being considered as a victim on the planet, and human security, which builds systems of protection at the scale of the planet to anticipate emerging infectious diseases. And there is a tension between these two visions of global health. So we can argue that if public health is a common good and an ideal for all living beings, its representation depends on the definition of who is considered as at risk, who can be integrated in a community of exposure. In the preamble of its constitution, WHO defines health, I quote, as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But we see in this definition that the occurrence of disease is a condition to represent an individual or a population as healthy or not, even if complete well-being is the ideal that is promoted by WHO. So between the ideal and the representation, different concepts of health suggest how to integrate living beings in a community at risk. We can define a concept as a way to act on reality, to grasp a perspective on things. Global health takes the perspective of humanity, planetary health the perspective of the planet, eco-health the perspective of an ecosystem, and One Health the perspective of animals. And we need to bring all these perspectives together to tackle the challenges of emerging diseases. So how is it possible to look at human health from the perspective of animals? This raises important questions on the possibility to decenter ourselves by scientific experience, to cross species borders, and to build an equipped empathy with non-human animals. The concept of One Health thus resonates with a major trend in contemporary societies, which emphasizes the competencies of animals, their capacity to communicate and interact with humans in smart and unpredictable ways. But it does so not through intersubjective relation, but through the surveillance of potentially pathogenic microbes. The term virus hunters has been popularized in the 1970s after the famous book published by Paul de Krief in 1926, Microbe Hunters. A virus hunter goes into the field, natural reserves, markets, farms, to capture the perspective of animals through microbes they share with humans. And the virus hunter brings back signs of diseases that may affect humans. There are many discussions in the field of ecology of diseases to know whether targeting some viruses in human populations is useful, or if the widest range of potential pathogens should be studied by extensive sampling. I rather want to question the anthropological dimension of this work of virus hunting, which is so constitutive of One Health. We have discovered across the 20th century a range of microbes humans share with other animals, for the best and for the worst. It would not be possible to extend human health to other living beings if there was not this perspective given by microbes. Microbiologist Joshua Lederberg was one of the key players in the concept of emerging infectious diseases in the 1960s. Thus wrote in 2000, it is time to abandon the old metaphor of war between germs and humans, replacing it with a more ecologically informed metaphor, which includes the germ's high view of infection. We often think of microbes as intentional entities that seek to replicate at the expense of humans, but they should rather be seen as pieces of information which increase their chances of replication by invading different evolutionary niches. So just as hunters communicate with animals they sometimes kill, microbe hunters perceive animals at the same level as humans through the mutations of microbes, even if the necessities of public health sometimes lead authorities to kill animals when they are perceived as a reservoir of pathogens for humans. And often we think of zoonosis only by the images of animals slaughtered to protect human health, but there are many other relations to animals among virus hunters. The concept of One Health forces us to think differently about nature. This term, nature, designated for 19th century philosophers all the living beings that were subjected to human action, even sometimes human exploitation, because they follow regular mechanisms that are known by humans. But the discovery of the causal implication of microbes in human diseases led microbiologists to think of nature as the result of an unstable balance between living beings, and sometimes even as a force revenging against humans to return to a prior state of equilibrium. And this ambiguity has been often mentioned at the beginning of this pandemic, perceived as a revenge of bats against humans for the destruction of their habitats. And it's striking to return to one of the founders of the concept of emerging infectious diseases, René Dubos, who was one of the first to observe bacteria as resistant to antibiotics, and who has this famous quote in the 1960s, "Nature always strikes back. It takes all the running we can do to remain in the same place." And of course, this also resonates with our current debate on vaccination. The Australian immunologist Frank Burnett said in a similar vein in his Natural History of Infectious Diseases, "Nature has always seemed to be working for a climate state, a provisionally stable ecosystem reached by natural forces. And when we attempt to remold such ecosystem, we must remember that nature is working against us." This idea that nature is trying to return to an equilibrium has been changed by recent emergences of infectious diseases. The idea that diseases are ways for ecosystems to regulate themselves by destroying the weakest populations has entered into crisis. Microbes have become signs of irreversible processes of extinction which should be anticipated. Extinction of other animal species, and maybe potentially extinction of human species, as we understand in the concept of pandemic as a disease affecting the whole humankind. This has been expressed by the more recent idea of nature as a bioterrorist threat, where outbreaks of infectious diseases can happen anywhere or at any time. So to understand this idea, we need to abandon the idea of nature as an equilibrium, where humans act as an epidemiological dead end, and conceive it as a disrupted system where humans play a central role. A key concept which appeared parallel to One Health is the concept of the Anthropocene. It was promoted by the geologist Paul Crutzen to describe the effect of the human species at the scale of the planet. This concept engages the community of geologists to look for indicators of the human impact on the planetary surface, such as radioactivity or carbon dioxide trapped in ice or wood, just as they looked for indicators of previous geological eras. So the concept of the Anthropocene appears as the reverse side of the concept of One Health, because geologists point to human responsibilities in the past, while microbiologists look for signs of diseases that can emerge in the future. However, there are some connections between these two concepts. Paleobiologist Jan Zalaziewicz has argued that the red jungle fowl, the famous Gallus gallus, domesticated in South China 10,000 years ago, could be used as a marker of the Anthropocene, because the increase of its size and the frailty of its body when it's industrialized allowed geologists to measure by its bone remains the effects of its industrialization. This resonates with the observation that the livestock revolution that occurred in the 1970s has dramatically increased the number of animals raised for human consumption, and thus the chances for pathogens to emerge in this reservoir. The multiplication of 100 by 100 of the number of poultry raised in China between 1968 and 2005 was often used as a key figure to justify the global fight against avian influenza. So the reduction of biodiversity in populations of birds and bats, as you can see from these figures of the IUCN, makes the transmission of a pathogen more dangerous because it is not diluted between different species living in proximity. It does seem difficult to apply the concept of public health to the challenges of One Health, and that's one of the major arguments I want to make. It is not possible to have a risk analysis for diseases emerging among animals because the possibilities of mutations for pathogens are just too numerous. And that's why we have to shift from prevention, which was the rationality of public health, to preparedness, which is a new rationality governing global health. It means that we have to prepare for zoonotic emergencies wherever they happen by fostering the immune capacities of human and animal populations living in proximity. A zoonotic spillover is defined as an event with a low probability and catastrophic consequences, which can be mitigated by techniques of anticipation. And these techniques often come from the world of wild nature, contact with wilderness, being able to manage in an environment that has become unpredictable. Hence the cover of this book, of this poster, hence this poster that uses the competencies of Boy Scouts. But we can see how all the vocabulary of virus hunters returns to this idea of nature as a wild environment producing unpredictable emergencies. So the logic of preparedness has been applied to epidemic events as a transfer from military logics coming from civil defense or war against terrorism, or Boy Scouts, the idea of preppers. But it doesn't mean that humans are at war with nature. Rather, preparedness is an opportunity for humans to imagine their vulnerabilities from the perspective of animals and microbes. Or, for example, a bat or a bird can enter a city by the weak points of the wet markets or of the industrial poultry chain. Preparedness is defined as a constant state of vigilance and attention to the potential ruptures in the vital infrastructures of social life. Through sentinel devices as early warning signals and simulations by worst-case scenarios, strategies for One Health mitigates the effects of zoonotic pathogens by fostering communities where humans live with animals. This is where I think we can intervene as social anthropologists to discuss how One Health strategies can integrate different kinds of knowledge humans have developed about animals in this global rationality of preparedness. Risk analysis or disaster management is just one frame of representation to think about the health of animals and humans. But there are other means to think about zoonotic pathogens. Animal breeders, for instance, often think of domestication as an exchange of care against animal products, and the emergence of pathogens as the sign that this exchange is betrayed. So how to restore this trust between humans and animals is a key question for animal breeders in contemporary conditions of breeding. Biosecurity measures, which privilege closed industrial farms at the expense of small-scale open-air farms, should take into account this question of what is a healthy and fair technique of domestications. In societies where humans think they have kinship with animals, such as Aboriginal people in Australia or Philippines, eating bats is conceived as sharing substances and forces rather than being exposed to microbes. And more closer to us, humans living with companion animals in urban areas have also developed capacity to perceive signs of well-beings in their loved ones. And they learn to pluralize these signs by observing animals in natural parks or taking part to programs of participatory science in wildlife surveillance and control. So zoonosis reveal recent transformations in relations between humans and animals, particularly the increasing separation between animals as pets receiving care and animals as commodities exposed to risk. But between these two opposite views, there is a space for a wide range of perspectives on animals as companion species. So I conclude on these few remarks, and I'm very happy to launch the discussion for this workshop.
Thank you very much, Frederic Keck, for this very interesting presentation, short one and very good beginning to understand how this concept stepped into our life and how to connect it with public health. And in fact, I remind everyone of the opportunity to ask questions to our speakers thanks to the question window, which should be normally on the bottom right of your screen. Right for the moment, if I'm not mistaken, there is no specific question from the audience. So don't hesitate to ask your questions. But I have a few ones for you because it was really interesting, and I'd like to know a little more about zoonoses. It seems that how do these zoonoses you talked about reveal relations between humans that we are and animals?
So zoonosis is an interesting concept that has become popular with the pandemic of COVID-19 because we have learned that pathogens coming from animals produce immune response in human organisms that are unpredictable. We are not immune to pathogens coming from animals. And our immune system often overreacts to these pathogens coming from animals. The concept of animal diseases is larger than the concept of zoonosis because there are many animal diseases that circulate among wild animals or domestic animals that have economic consequences, but that don't produce new diseases among humans. So when a pathogen crosses the border from other animal species to humans, it raises affects of fear, and we need to understand this fear in a long history of relations to animals, particularly in wild environments. And we also need to explain the mechanisms of emergence of pathogens precisely to tame this fear and to explain how zoonoses are just one of the pathogens, are just a part of the pathogens that circulate among animals. So to produce One Health as a collaboration between human health and animal health, we need to go beyond the fear of zoonosis.
Okay, and as your anthropologist, how can social anthropology contribute to improve animal surveillance, which is at stake and which is so important, as you underlined it?
Social anthropologists have been enrolled in the surveillance of animal diseases and zoonosis because some behaviors are described as obstacles to good biosecurity measures. For example, wet markets in China, where humans buy live poultry and they consider it as an auspicious way to present food. This is considered as dangerous from the perspective of biosecurity. But if we understand the role of animals in the lives of people, for example, what is a good bird, what is a good poultry, what is a complete living being for a Chinese consumer, then we can enroll ordinary citizens in the surveillance of zoonosis. For example, in Hong Kong, when I did some work, consumers who want to buy live poultry have to go through a corridor where there is information about the risk of buying live poultry. And so social anthropology can contribute to producing information on the risk. But beyond the framing of risk, there is also the possibility to include other views of animals, such as animals sharing kinship, or animals being a population, a swarm that is under a threat of extinction. And all these different representations of animals must be taken into account to promote the ideal of One Health.
Okay, so thanks for everyone. Thanks to everyone for asking a few questions. Now they are just coming into the question window. So we have several of them, and the first one is very interesting. You stated that preparedness should be favored over prevention because of the difficulty to assess risk in One Health perspective. What about the prevention at the source? It means to work on social, eco, and ecosystem to mitigate the conditions of emergence of zoonosis. What is your anthropological perspective on the topic?
So the distinction between prevention and preparedness is one of my key ideas, because when a zoonosis arrives on the territory, it is often difficult to understand why it is managed by techniques of emergency, such as surveillance, or the use of priority goods such as vaccines and masks. And we think of prevention as the distribution of goods to populations at risk. But preparedness is another way to visualize the space of a territory, of a city. We do this through scenarios, for example, for simulations. We train people in hospitals, in markets, to understand where an animal with a virus or a patient with a new disease can arrive. And this is not prevention properly. So prevention is a technique of anticipation, but preparedness is another technique of anticipation. And so we need to distinguish those two and bring preparedness back to a genealogy of precisely perceiving pathogens from the perspective of animals, which is something that virologists have learned to do, and that they can share with other actors of preparedness, such as hospital workers or managers of stockpiles of vaccines, for example.
Thank you. Another question from this time, Guillaume Convert. Does domestication of animals means domestication of microbes, domestication of diseases, domestication from etymology domus, bringing it home?
Thank you. That's an interesting question. So domestication is a long-term process that started a long time ago, with different species, and there is speculation on the fact that a lot of zoonoses emerge with domestication because humans learn to live in proximity with animals. And another speculation is that with the livestock revolution, we have broken the equilibriums of Neolithic techniques of domestication. So we need to live with other forms of domestication, which is not including animals in the human house, which is the meaning of domestication, but which is rather bringing animals in biosecure spaces where pathogens will not circulate. And we see that this new form of domestication doesn't work. Biosecurity, as we see with the current cases of avian influenza in France, and debates about open air breeding, biosecurity doesn't work so much in these closed domestic breeding spaces. So domestication of animals has taken a new form, and domestication of microbes is something that happens in laboratories. Microbes circulate in the wild, but they are cultivated in laboratories. We can tame microbes, for example, with techniques of vaccination or study of mutations. And there is the same relation between what happens in the laboratory and what happens outside. There is precisely this measure of biosecurity to control the potential release of microbes from the lab. So microbes and animals all live together in biosecure spaces, but we need to think of domestication in this new closed spaces regulated by biosecurity.
Okay. We've got several questions also from speakers who will talk just after you. It's very interesting, namely Mario Koopmans from Erasmus Medical Center. So we just give her the floor just after our questions and answers. But she asks, you mentioned animal health and human health. How do you see the environmental health angle? Spillback into wild animals has been a problem with outbreaks and commercial livestock farms, for instance.
So, environmental health is much more difficult to perceive than animal health. There is a form of empathy with animals that is evident from the signs of well-being or the signs of disease. We can see that the chicken is sick by the way it reacts to avian influenza, by digestive trouble, for example, or simply by death. It's more difficult to perceive that a forest is in a bad health, and it's even more difficult to perceive that the planet is in a bad health. So that's why we need to bring captors, we need to bring sensors, and we have this at the level of the planet, and they give us information about global warming or effects of drought on the forest. But we also have that at the level of animals, and that's the sentinel devices that I was talking about, like non-vaccinated chicken in a farm, for example. So I think the zoonoses are interesting because precisely we have more empathy with animal health than with the health of other living beings.
Mm-hmm. And a question from François Vandeness. As you describe it, it seems that preparedness is just prevention from a far upstream standpoint. Do you agree with that?
So preparedness is prevention at the global level. And so if we move beyond the frontiers of the territory, and we think of all the chains of reaction and interdependencies at the global level, then we perceive the territory not as something that should be protected, but as something that is vulnerable, and we need to identify the sites of vulnerabilities, like how to enter the city, how to regulate the food chains. These are new questions of preparedness that prevention didn't raise, because prevention was mostly about the distribution of risk.
Another question coming from the audience, Firaoul Bekele. I believe that we need to create strong One Health institution to prevent zoonotic disease, especially in underdeveloped country. So what do you think, or how do you think we can do this? Because the problem occurred anywhere in the world, can reach everywhere, as we've seen it with COVID-19.
Yeah, so the development of One Health in less developed countries or the global south raises the question of the articulation between food security, which is a major concern for northern countries, and food safety. That is how to build a sustainable form of animal breeding and control zoonosis while maintaining a regular amount of proteins in the food chain. So I guess that's why the debate about wet markets in China is so interesting, because a country that has moved to a form of abundance and prosperity still has this form of providing food, which follows tradition, but which doesn't really correspond to any form of protein sustainability. So we need to work on the social aspects of this of these new markets in global South, and we need to work with communities of operator to understand how they can transform their practices to follow biosecurity measures.
Another question coming from a speaker, Orla Shortall, who will take part to the round table at the end of the morning. She says, thanks for the interesting presentation. And you mentioned the previous concepts used to manage the intersection of human health with other domains. Do you see anything new, particularly valuable about the One Health concept?
So the One Health concept is new to the concept of global health, which appeared earlier, probably in the 1990s, because it doesn't stay in the realm of humankind, but it also brings other animal species. And we can argue that it was already there in the 19th century with Virchow's anatomy, or that it has been supported by, for example, Karl Schwabe in the idea of veterinary health in the 1960s. But the idea of One Health, as I understand it, is to coordinate networks of surveillance between veterinary health and human health, and to bring data sets of surveillance together, and it's not only a coordination of networks, it also connects problems in hospitals and problems in farms and markets, which are very different spaces, but connected through forms of organization that must be understood in their transformation by the circulation of commodities.
Thank you very much, Frederic Keck, for all these precisions. And you see that your presentation raised a lot of very interesting questions, and the answers were really exciting. Thanks a lot for participating. I think you must leave because you teach in a few minutes. So thanks for participating again.